I would say that her facial features are symmetrical. The hair growth and pattern is normal. Ears are normal. I would ask her to smile, and I would see that her mouth moved correctly. I'm noting her eyes now. Eyebrows and eyelashes are present. They are clean. There's no drainage, no crusting. There's no ptosis noted. Sclera are free of icterus, and conjunctiva are clear. I'm going to ask you to hold this about 12 inches from your face. Cover one eye, read the lowest line you can, and then you'll switch and do the other eye.
LTFPH.
Okay.
LTFPH.
Okay. All right, and now I'm going to have you, I'm going to test your peripheral vision now. So what I'm going to have you do is cover one eye, whichever eye you're comfortable with, and I'm going to have you stare here at my nose, pretend you can see it. I'll have you stare here, and I'm going to hold my hands up, and I'm going to put numbers out, and just let me know what numbers you see, okay? All right, stare here at my nose, okay, and tell me what number you see.
2, 1, 3.
Okay, and now switch and do the other eye. Right here on my nose, and numbers.
3, 1, 3, 2.
There you go, very good. How are you doing so far? Okay, I'm going to have you stare at the tip of the pen light. I'm going to move the light, and I want you to track it with your eyes. If at any point you feel any discomfort when you are moving your eyes, let me know, okay? All right, stay right here at the tip. The eyes are moving and well coordinated. There is no nystagmus noted thus far. Last one. All right, there was no nystagmus noted. Did you experience any pain or discomfort when you were moving your eyes like that? Okay, now I need to check your pupils. I will have to shine a light. Do you have a history of migraines or seizures or anything that could cause you to react negatively to the light? Okay, it'll be quick, 2 flashes in each eye, okay? Okay, how was that? Okay, the pupils were round, briskly reactive. Round, reactive to light, and there was accommodation noted there. Okay, next, need the pen light again. I would look at her mouth, again pretending that this is not COVID, and I would ask her to open her mouth, and I would examine her mouth with the pen light. I would note the mucous membranes. Ideally they should be pink and moist. They would be free from lesions. I would note if there was any bleeding from the gums, and I would notice if she had any problems with dentation or any dental caries. Still looking at her mouth with the pen light, I would ask her to say ah, and when she did so, I would notice if the tongue and uvula remained midline and if the soft palate would rise when she did so. Right now, I would ask her to stick out her tongue. Doing so, I would note that it's midline. If there was any deviation, I would also take note of that. How are you doing so far?
Good.
Okay. Now I'm going to start testing the strength in your shoulders, your arms, and your neck, okay? All right. I'm going to ask you to shrug your shoulders. Don't let me push them down. Okay? Now I'm going to put my hand on your face. I'm going to ask you to try to turn your head against my hand. Good. And other way. Okay, good. Was there any discomfort with that? Okay, the strength in the neck and shoulders are appropriate. I'm going to have you circle your shoulder, one arm, then the other. Okay, can you bend at the elbows? Excellent. Spin the wrists. Open and close your fingers. Okay, she has full range of motion in both of her arms. I'm going to test the strength in your arms. So what I'm going to do is I'm going to have you make a fist, and I'm going to try to pull your arm. Don't let me, okay, now push against my hand. Okay, other arm, pull, and push. Excellent. Strength is equal bilaterally. Can you grab my fingers? Squeeze. Squeeze, squeeze. Strength is even in both hands. Going to check the pulses. Okay. present and even. Turgor is good. See the tips of your fingers? Your hands are cool. Cap refill is good. There is no clubbing or cyanosis noted. I'm going to move to your legs now, okay? Let me know if there's any pain. I'm going to put my hand on your knee. Try to have you pick your knee up against my resistance. Okay, good. Other leg. Excellent. Strengthen the hips is equal. Now I'm going to come down to your legs. Try to pull back against my arm. Okay, push forward. Okay, other leg. Pull back and push forward. Okay, and then the feet. Give me your feet. Press down like you're pressing the brakes. Okay, and now try to pull up. Good. Strength is equal, and the knees, the ankles, bilaterally. While I'm down here, I'm going to look at your legs. I would pretend that this person has nothing on their lower extremities. I would palpate any pain in your calf. Nope. Nope. Okay. I do not notice any suspicious rashes, lesions, moles. There are no varicosities present on any aspect of the legs. I would palpate down the tibia for any edema, of which there is none. Alongside the medial malleolus, there is no edema. Do you mind if I take your shoe off? Okay. Oh, really? Okay. There is no edema on the dorsal aspect of the foot. I'm going to go ahead and palpate for pulses. There's a good dorsalis pedis and posterior tibial. Can you wiggle your toes? Okay. Check. Cap refill is good. Can you feel this on the bottom of your feet? No numbness or tingling? Okay. You'll get it on? Okay. Okay. Any pain in this leg? No. Okay. I would look at the skin. The skin tone is appropriate for her color. There's no suspicious lesions, masses, or moles. Other than the tattoo on this foot, I don't notice any scars or tattoos on this one. Okay. There is no edema along the tibia. There's no edema back by the medial malleolus or on the dorsal aspect of the foot. Okay, the dorsalis pedis is present. Posterior tibial pulse is also present. Can you wiggle your toes? Okay. The cap refill is fine. Can you feel this? Yeah. Okay. No numbness or tingling in this foot either? Nope. Okay. Okay, so the arms, there is a tattoo noted over here. Other than that, there are no lesions, masses, or rashes that I should be concerned about. Is that a mole? Mm-hmm. Okay. The skin color is appropriate for her race. Feet, I already did. Okay. At this point, I'm going to start listening to your lungs. Okay. I will ask you to say 99 a few times just so I can feel kind of the vibrations, okay? Okay. Coming around, I noticed that the AP to T ratio is 1 to 2. Ideally, this person would have just bare skin on the back. I would note if there were any suspicious lesions, masses, rashes, scars, or tattoos. I will pretend in this case that there are none. All right, I'm going to move your hair to the side. All right, go ahead and say 99 for me. 99. Again, 99. 99. Okay, tactile fremitus is within normal limits. Okay, I will be listening. There are going to be 9 breath sounds on each side. Just so you don't get short of breath or dizzy, go ahead and take normal breaths while I am doing this. So it'll be 1, 1, 2, 2, 3, 3, and I would be listening for a full inspiration and expiration on each side. 4 and 4, 5, 6 lungs are clear to auscultation throughout. I will come and I will listen to the lungs on the front part of your body. There will be 5 on each side. Again, just normal breathing, and we'll pretend that I am listening. On bare skin, I would examine the anterior portion of the thorax and make sure that there are no masses, lesions, rashes, no scars or tattoos. Okay, so just normal breathing. But I would listen for 1 full inhalation and exhalation. 2, 3, 4, 5. Okay, and I'm going to ask that you lift up your right arm. And I would listen for 3 breaths here. 1 in and out, 2 in and out, and 3 in and out. And please lift up your left arm. 2 inhalations and exhalations. 1 in and out, 2 in and out. Okay, how are you doing so far? Good. All right. I'm going to listen to the vessels on your neck before then I will palpate for any lymph nodes. The lungs were clear to auscultation throughout on the both anteriorly and posteriorly. All right. Go ahead and take a deep breath and hold it. Okay, there is no carotid bruit noted. Go ahead and let it out. And then take a deep breath and hold it. And exhale. There is no carotid bruit noted on either side. We're almost done. I'm going to feel around the back of your head, around your ears, and through your neck to see if you have any lymph nodes, okay? If there's any tenderness when I'm doing this, please let me know. Go ahead and take a deep breath in. Any pain here? Nope. Okay, there are no lymph nodes present. I'm just going to feel your carotid pulse. Okay. Other side. Okay, the carotid pulses are present bilaterally. At this point, if you are comfortable, I am going to ask you to lay back. I'm going to pull this out so you can rest. Sorry about that. Sure. Okay, let me make sure I have, actually, I don't think that because I'll be on this side, so maybe this will work. Yep, okay. Again, this person would have on nothing except a hospital gown. I would have them covered up to about here with the blankets. I would pull the gown down. I would inspect the thorax. I would lay the bed completely flat, put it up to about a 45-degree angle to assess for any JVD. I would have her look away from me. Look away, like you turn your head. Thank you. Okay, and then look towards me. And I would note that there is no JVD present. I also noted while I was down there that there were no heaves, lifts, or pulses on the anterior aspect of the chest. At this point, I am going to listen to your heart. I'm going to listen in about 5 areas, and then I'm going to pause for a moment when I get to the lower portion of your chest, okay? So while I am listening to the heart, I will also be feeling if there are any thrills present. I'm listening in the apical area.
Aortic.
Atrial
Aortic.
area. Pulmonic. I'm noting no thrills. Come into the center for Erb's point. Tricuspid. Still no thrills. And mitral. While I'm here, I am going to note the apical rate and rhythm for a full 60 seconds. 60 seconds has passed. We will say that the heart rate was 82. And before I leave, I will palpate the radial pulse to see if there is a deficit between the apical and radial pulse. There was none, and there were no thrills inspect her abdomen. I would look at the abdomen and I would notice its contour. It is flat. It is symmetrical. I do not notice any scars, any tattoos, masses, suspicious rashes. The umbilicus is present. There is no crusting, there is no discharge from the umbilicus, and no surrounding erythema. I'm going to listen to your belly. I'm going to listen in about 4 spots, okay? Bowel sounds are normal and active throughout. At this point, I'm going to palpate your abdomen. I'm going to do it 4 times with light pressure, and then I'm going to come back through with the deeper pressure. If at any point you feel any discomfort, please let me know. Any pain or discomfort there? No? Okay. All right. Deep palpation. Any pain? Okay. And continuing with deep palpation. Okay. There was no pain or tenderness. Okay. There was no rebound or guarding present. At this point, this is the end of my head to toe examination. If we were in a hospital setting, I would make sure that the bed was returned to the lowest position. Side rails would be up ×2. I would give the patient their call light and ask them if there was anything I could get them before I leave. And do you want me to help you sit back up? Okay. I thank you for your time, and if you need anything, let me know. Okay. So I had this patient who I had noted that she was alert and oriented ×4. I had checked her name and date of birth and allergies with her band. She had no current complaints of. She had no current pain. Well, she had pain that she rated on a 1 out of a 1 to 10 scale. She was currently on no medications. She stated that she had no past medical history and no past surgeries. She had a social history which was negative for tobacco, alcohol, and illicit substances. She is married and states that she feels safe in both her home and her relationship. When she walked, she had appropriate gait. All of her limbs moved freely. She was able to maintain an erect posture when she was both sitting and walking. Her affect was pleasant. Her mood was appropriate for the situation. Speech pattern was clear. It was a regular rate. Hygiene was appropriate. She appeared to be appropriately nourished throughout the exam, in which I was pretending that she was in nothing but a hospital gown, maybe her undergarments, other than a tattoo on the bicep, the left bicep, and her right ankle. There were no abnormalities noted. I noted no scars, no rashes, lesions, masses that were of note. Strength was equal in the shoulders, both upper extremities, both lower extremities. There was no clubbing, cyanosis, or edema noted throughout the exam. Pulses were palpable in both the upper extremities and lower extremities, as well as the carotids. Her lungs were, her eyes were clear. They moved well. There was no pain or discomfort, and the vision was within normal limits. Mouth, there was no problems with dentation. Her soft palate, if we were pretending that she did not have a mask on for the examination, the tongue was midline as well as the uvula. When she said ah, the soft palate actually raised. AP to T ratio was within normal limits for this patient. It was 1 to 2. Lungs were clear to auscultation, both anteriorly, posteriorly, and laterally. There were no lifts, thrills, heaves, pulsations or carotid bruise noted throughout. Listening to the heart, it was a regular rate and rhythm. I noticed no murmurs. The abdomen was benign. There was no tenderness to palpation, and the bowel sounds were present and active.